Welcome. We are recording this session, as you heard the recording in progress going on, as we said we would for those who were unable to attend. I see that we have many more people waiting, so thank you for joining us today. For the California Academy of Family Physicians, we are running this initiative, the California Residency Program Collaborative. It's our third go around, and we're so excited to be here and have you join us today. And I'm going to let Lori, maybe I can ask you to, or Anita, whoever is on top of the letting the people come in as they join us. I see we have several. And Anita, by your smile, I'm assuming you're the one that just let them all in. So anyway, thank you for being here. First and foremost, for the work that you no doubt do to help patients in this state with opioid use disorder and substance use disorder. And we are thrilled that we are able to, again, be able to offer this grant learning collaborative to ACGME residency programs across the state and their partners to really allow you guys the opportunity to develop your own local opportunities and ideas to help your patients with substance use disorder and opioid use disorder. Obviously, we did issue the RFA. I'm not going to take the time to go over it. I'll first let you know, you are all here to ask questions, hopefully, or at least get clarification. We are also, again, like I said, recording this. We'll go ahead and post it up on the website with a list of the questions and answers that we get today. We also will put links in the chat today for you to get access to our FAQ document, the allowable cost document. We'll be updating the questions and answers on that document on our website as we progress throughout this course before the grants are due on the 31st of January. And of course, we would like your expressions of interest on January 13th in this grant. It's not required, but it gives us an idea of how much more marketing we need to do to get this opportunity out to your peers around the state. And I think that I hope we answered a lot of your questions in the RFA. I will, if I need to, take the opportunity to share our website, which has links to this RFA. It has links to the allowable cost document. It has links to the FAQ document. Like I said, it also has links to our SOR2 funded collaborative that is just concluded, to their final reports, so you can get a taste of what some of our former grantees have done. This RFA, of course, is now focused on the new priorities that Department of Health and SAMHSA have identified. Same as prior priority. Well, one, before I forget, I want to say too, what's new with this RFA is that all residency programs, ACGME accredited residency programs, are allowed to apply. So even those that have received past grants from us are also allowed to apply, which is exciting for us. We will be awarding 25 grants. And again, the focus and the goals of the state and SAMHSA are really to look at addressing, the usual, increasing access to MAT. And we do, as an academy, have an opportunity, and I know it will be put in the chat as well, for us to help identify some MAT champions out there, some of you or your colleagues that are absolutely offering these services to their patients and are willing to share with their colleagues advice or answers to questions newly trained or those in providers that are just now offering MAT services. We'd like to, amass a group of folks, champions that they can call on for help and assistance. So the form, I think the link to the form is there, and we certainly can answer any more questions about that. But the goal of this, of course, is to increase services. We want to reduce the unmet treatment needs. We want to address fentanyl, which we know is a big problem, obviously, here in California and elsewhere, and really to focus on reaching those vulnerable populations and underserved populations and addressing health equity, which is why we put in the RFA the statement and the date about mandatory health equity workshops we're going to be holding at the beginning of the grant cycle, just to make sure everybody is on the same page about priorities to really reach those folks that are underserved. So before I could keep talking and talking, but I want to make it clear that no question is a dumb question. Really feel free to either type them in the chat if you don't want to unmute yourself and ask it directly. Or you can always email us afterwards, and all the questions we receive, we will put in that FAQ document for everyone interested in the RFA to benefit from. So I wanted to, first of all, also, which I obviously missed doing, introduce myself as the Vice President of Education and Professional Development for the Academy. I'm the one leading this effort, but I couldn't do it without my two colleagues here, which is Anita Charles, who is our program coordinator for CME at the Academy and has been actively involved in our prior CRPC initiatives. And then Lori Eisenberg, who is a fairly new employee to the CAFP, but running a lot of our activities around OUD and SUD. And so she will be a resource as well. Our colleagues from the IPMA, the Interstate Postgraduate Medical Association, are going to be running our QI component, our quality improvement component, which really, as part of a learning collaborative, which is what this grant and what this initiative is, we want to set all of our grantees up for success in achieving those aims and those projects that they identify. And we contract with IPMA, a portfolio provider who has vast experience in helping folks achieve their aims and statements through quality improvement work. And they did so with our former grantees. So we are going to be taking advantage of their expertise and sharing that with all of our grantees moving forward, so that you can all successfully complete a QI project, get your maintenance certification credits. I know all residents, at least in family medicine, have to have a QI project before they sit for their boards. So hopefully that will also be a benefit of this this initiative. So anyway, so I do see the first, what's the timeline over which funding should be used? So the timeline for this RFA is basically April to June 2024. So the funding will be, you get your first payments in April, and then we expect final reports in June of 2024. And so that is the extent of the activities that we're asking people work within. Let's see what other questions we have here before we open it up. Okay, I did that one. How are the harm reduction initiatives outside of MAT prioritized? Really, honestly, we don't have a particular priority scale on those initiatives. We have an expert advisory panel made up of specialists in all the different clinical areas. They look at the goals of the individual institutions, the applications. They prioritize based on that rating scale, which we provided, I think, in the RFA, I hope, looking at how your efforts and your goals are going to be serving your patients. So there is no priority of one harm reduction activity over another one. And we had a number of different programs last year and the years before spend a lot of their money in the harm reduction area. Finally, SAMHSA allowed us to have the funds spent on things like fentanyl test strips, and we had a number of groups last year put together harm reduction kits, which were absolutely fantastic. And we hope to share all the lessons learned from our prior grantees with you folks too, to give you ideas about some great things that has been done in the past. So hopefully, while MAT is always kind of our North Star, we want everyone. And one thing shared from the last grantee cohort was every resident coming into the programs instantly were sent in their applications for an X waiver. Or those eligible were sent in applications for X waivers because anyone can do that for them. It's really more administrative, and there's no reason why they shouldn't have it. And we heard a lot about the fact that they wish it wasn't called an X waiver. They wish it was called an application to become a superhero, because honestly, that's what we envision, buprenorphine treatment and this to be, because you are saving lives by just even initiating that treatment. So anyway, long answer, I think, to that question, but feel free to chime in if I didn't answer it. Can I elaborate on how you are looking for programs to incorporate fentanyl awareness into SUD curriculum? So again, we are wide open to, I mean, we all know how bad the crisis is with fentanyl. We want localized activities to make sense for your local community. So addressing fentanyl can be, there could be a myriad of ways you address fentanyl, whether it's just heightening awareness among some of your, well, obviously among your team, but also among those patient populations. Maybe it's reaching out to partnering with some of the community groups in your area to raise awareness around fentanyl and you know, the dangers it causes, the opportunities that we can move forward in trying to address this crisis. Also just addressing it with people who are concerned about offering MAT because of the fentanyl crisis. So I think there's a lot of opportunities there, and I don't think there's any one particular thing we're looking for. We're looking honestly for you folks to identify what you feel are local solutions to serving those underserved and vulnerable populations and patients who suffer with OUD and SUD. So no magic bullet there. Funding timeline. Oh, you put that in. Thank you. Oh, did I get all the questions in the chat box already? Yeah, and I do encourage you to look at our, I'm gonna, unless I see a lot of questions, I'm happy to share our website, although I think a lot of you folks can get to it as well. But because right there linked is the final reports from last cohorts. And there's, like I said, a lot of great ideas there. But just because we funded them last year, we don't want to, you know, we don't want in any way, shape, or form to leave you with the impression that we're looking for certain things. We are looking for what you think and describe as a local solution to getting those patients better service in this area. I know one question we got was around, you know, alcohol use disorder and things like that. So these funds can be used for patients who have co-conditions, not just alcohol use disorder. It has to be, they have to suffer from either opioid use or substance stimulant use disorder. And then you can treat and use these funds for all of those other things, but it has to be also a condition of OUD or SUD, in addition to, like I said, alcohol use disorder. Happy to open the floor to anyone who has questions. Right now, you can just go ahead and hit your unmute button if you'd like. And I see a lot of great names. First of all, you guys are all really fantastic for taking this on and being being superheroes in my book, for sure, for reaching your communities. And I know this is an effort above and beyond what you get paid to do in your day jobs. Certainly a lot of the funds were used in the past to supplement salaries for folks to really service their patients. You know, the usual suspects we heard in terms of problems were, why can't we spend funds for phones, you know, flip phones or whatever, portable phones? It's always a need. And because this is a federal grant, and one of the main stipulations is if there's money available elsewhere, don't use it, don't use our money to spend on phones when there are phone, you know, subsidies you can get in supplies elsewhere. Same, and unfortunately, it's the first time this year that your funds will not be able to be used directly for contingency management. And I know there's probably going to be a lot of questions around that, but because the state has a whole separate funding mechanism now for contingency management services, you need to go through that source to get those supplies or get that funding. We provided those links in that RFA as well for that, and are happy to shepherd kind of any concerns or questions you have to our contacts with that as well. The other thing I wanted to address is the fact that even though these funds are targeted to ACGME accredited residency programs, excuse me, there's certainly nothing that stops you from partnering with another nonprofit or another organization that you can team up with to help you with this grant. I mean, we definitely want to see the activities of the residents and the residency faculty and the programs themselves be front and center in servicing patients, but we know it takes a village. So there's no reason why you have to assume also the responsibility to be the financial coordinator, for example, of this. We can send the funds to another organization as long as it's clearly affiliated with the project that you as a residency program are doing to support these efforts. So just answering that up front as well. I think I saw another question. Do we incorporate the education, outreach, and treatment done at our partner's site into this grant application, or do we only focus on education, outreach, and treatment done at our organization? So this is obviously focused towards capacity building in our residency programs and direct providers. So, but as long as we don't say it cannot be focused in the nonprofit or the other organization, but there has to be a focus as well. It could be jointly focused, but focus as well on building capacity within the actual residency programs so that they can have that capacity moving forward and hopefully set the foundation for success in the future. So hopefully that answered your question, Pearl's question. So anything else that I'm not addressing? You can add to the site, or I'll go ahead and share my screen and just walk you through our website. Again, we want to be as transparent and helpful as possible. So like I said, there is nothing, no question that we won't consider answering and helping you with. Okay, so now I have to just move my bar so I can spam this. Hopefully everyone can see this. So this is our website, familydocs.org/CRPC, which is for California Residency Program Collaborative. And you'll see here that you can, what we will have, you'll see this little button that says Access Grantee Site. So once our 25 grantees are selected, we will go ahead and open up a private site for them that includes a lot more information about, in fact, I can actually show you this right now. I hope you can see it. Oops. Our secret password. So what we opened, for example, for our former grantees is allowable costs, which we also have posted elsewhere, but we will do monthly data collection that we stated in the RFA, and a lot of that, it's not meant to be a huge burden. I know 5% of your budget can go towards those expenses for collecting data, but we will also be asking a few other questions just based on what our grantees are doing so that we can get a sense across our whole initiative of progress. We will have report templates just like we have our budget template that's available to you if you want to use it. You don't have to use it here. So we require an interim and a final report, obviously, from our grantees. We put our key dates up here. We also have contact information, which is basically an opportunity for you to contact directly our former grantees, either from our 1920 collaborative or our last year's 21-22 collaborative. Also direct links to our expert advisory panel specialists who are helping us with this grant. And then California Bridge has been a fabulous support, also funded through SR 3 grants. But we added links to their regional directors. And so we also here, every time we had a virtual meeting, which, as you may suspect, most of our training and information and activities have been virtual the last couple of times. We're looking forward to a couple real live in-person face-to-face meetings this time. But we would post up on this website the recordings of those webinars and any kind of resources and materials that we got from those meetings. So also, but on the public site here is a summary of our California Residency Program 2 collaborative. So we did fund 16 programs last year. We funded more the prior year, and we're happy to be able to fund 25 this year. So of those 16 residency programs, which we'll see are linked across the state right here, We have gone ahead and posted their final reports in this document right here, where you can go back and look if you'd like to see the kinds of things that they did. Again, remembering that an additional stipulation this year is that the funds can't be used for contingency management. And then here you'll see, again, a copy to the you can download the RFA, you can download the allowable cost fact sheet, and then we will be constantly updating this FAQ document based on the questions that we're answering today. And then also, like I said, the questions that we're answering via email or any means of questions we get. We're happy to be transparent and put all of those there. So I'm going to stop sharing and see if we do have another question. So we have much greater issue with stimulant abuse, but a lot of language on this grant revolve fairly specific to opioid abuse. Do you have recommendations for? Don't see much opioid abuse. Is this grant not so relevant for our program, even though it technically is? Yeah. So again, I think, like I said, unfortunately, yes, the funds for this grant specifically have to address OUD or SUD, although stimulant abuse is SUD. So even though we do have a focus, it seems like, on opioids, I think clearly the funding can be used for stimulant use disorder as well. And they made it specific, DHCS made it specific that SUD does include stimulant use disorder as well. Like I said about the the alcohol abuse as well, that they want to see co-conditions, and maybe maybe I need more clarity over what stimulants, how they define stimulant, but I wouldn't hesitate to actually put that forward, because obviously you do have a certain amount of patients that are suffering from both OUD and SUD. And if you want, I will get more clarification around that use of the word stimulant. I know that maybe somebody else can help me here if there is a specific definition of that, but hopefully, we're not saying no to any kind of opportunity that is a great local opportunity to reach folks with OUD or stimulant use disorder, for sure.
Jerry, thank you so much for actually leading this important thing. I have a question for you.
Sure.
So it's mentioned that the funding starts coming April 1st, 2023. So does the program and all of the activity needs to be started now, or it can be started later? Because we are a new program, so we just hadn't got a chance to start anything yet, but that's the plan.
No. Yeah, absolutely. Your funding starts April 1st. You'll get your first milestone payment. But no, you can absolutely be setting up, making the plans and putting forth your plan to accomplish the goals that you set forth in your RFA, for sure. I mean, we don't expect work to be done on April 2nd, that you're busy out there, with your whatever your project is. So we did have a couple new residency programs that we have funded in the past. And so a lot of their initial work was certainly just getting their act together, and also really trying to getting help identifying their patient population, right? And they're reaching out into their community and making those ties with their community organizations to really get the word out there to patients that they're available for, they're open for business, right?
Thank you so much. Yeah, thank you. Okay.
Yeah, absolutely. So I do encourage all of you folks to reach out. If you think later after this webinar that you've thought of some more specific questions, after maybe going to the website and reviewing some of those past programs that are, activities that were funded. But again, I really truly encourage you not to limit your thinking to even those. We want we want you to be creative. We want you to really focus on reaching those valuable, of course, all your patients are valuable, but your vulnerable patients and underserved patients, because I know that is a focus this year, is really reaching out to those patients that are not getting the service that they need right now, for sure. So, yeah. And again, as I think we put a link in the chat box, I know a lot of you certainly are interested in this residency program grant, and we will throughout the year try and find resources. There's a lot of funding, as you know, no doubt, available from myriad of sources, but the state through SOR3 specifically has a lot of funding still available, even outside of this initiative. So as we find other sources for funding, certainly the contingency management is front and center up there, and we're letting everyone know about that and encouraging them to apply. But as we find and locate other funding sources, we're happy also to share that information out, because it's there. It's just a matter of sometimes really hard to find within the maze of all those state bureaucratic levels. So I know that, that's also something that we'd like to help with. And one of the most rewarding parts, I think, of this initiative is that you really, as a organization, have an opportunity to meet with your peers and your colleagues across the specialties. We saw a number of residency programs that were in the same institution apply, and really it was amazing to see how this gave them an opportunity to really take that time to get to know each other better, get to know their processes better, and get to really identify how they can work together to meet the services of their patients. Because there was a lot, as you know, in your very, very busy worlds, you're nose down addressing everything that's immediate day to day. I think this gives you an opportunity to step back, benefit from all of those things that are happening and creative ideas that others have across the state about what's worked for their organizations, what hasn't worked for their organizations. Don't reinvent the wheel when those wheels are already developed. We hope to focus a little bit more this year on providing templates, training templates, and things that more or less train the trainer, where we can help you train your own folks in your own institutions, and so that you're not reinventing the wheel. We have a lot of great ideas, like I said, from the past, where they developed things like badge buddies, which were fabulous, binders for an institution to use to help them instantly answer a lot of those frequent questions that their providers had. And so we want to be a resource to you, and hopefully, obviously, our goal is to provide a lot of great service to patients across the state. We do, pay attention when you're applying for the grant to those dates on the RFA, where we will, for the first time, and I'm so excited about it, meet in person, not only at our kickoff after the grants are awarded, and our first meeting will be a live, in-person meeting, and then also at those health equity workshops that we're going to be holding on in April. Early on, you'll attend one of them based on your geography. It'll be one day in Southern California, one day in Northern California, where we bring all the grantees together, really for a focus on discussing health equity and how we can help each other in that area. So a lot of great resources, we think it's an exciting initiative, and we're glad that you found it. At least we piqued your interest enough to get excited and sign on to our FAQ anyway. And we hope that this gives you a lot of great information and ideas to move forth and really apply for the grant. We try to make it as simple as possible. We provide you with a very simple budget template. We do ask that you really put some thought into your goals, and that's why we no doubt most of you have heard about SMART goals, but that's really, we want you to take a step and think about what those are. One of the biggest issues that you will hear about through our IPMA folks is that you guys are so fabulous and you want to shoot for the moon. Your goals are lofty and they're way up there. When in reality, when you're doing QI work and performance work, you're setting a foundation for success, and you really need to learn how to, build that rocket ship first, maybe before you head off to the moon. And so we kind of help, a lot of their work is helping you identify measurable, clear aims that you can actually accomplish, right? And that you take your first steps towards reaching those more loftier goals. And it really does, you know, our former grantees have been fabulous about sharing how thankful they were for that, just that process of how to set up the foundation to do a quality improvement project. Because they, you know, a lot of our grantees are using it in a lot of different areas, not just obviously reaching, servicing their OUD, SUD patients, but in a number of other clinical areas in their institutions. So yeah, and then also, you know, we spend a lot of great time doing regional workshops where we help our grantees connect with their local community partners. So in this day and age of everyone knowing the importance of social determinants of health, and really it takes a village, certainly, to service these folks, we want to really encourage those local community connections and in any way we can. And so it was just really gratifying to see at our workshops a lot of the people meeting, you know, putting faces to email addresses for the first time for services that they were really in search of. And these people have them, and it's great to connect them together. So anyway, do I have any more questions, Anita, that I'm missing in my chat box? Can you see? Or is anyone, if anyone's interested in unmuting and asking a question, or again, Anita, maybe you could put my email address in the chat box, just so for those super shy, quiet people that think of questions afterwards, you can certainly email me with them. We don't claim to have all the answers, but we know where to get them. And our partners at Department of Healthcare Services already have a few questions from us that we want to get answered from them, and we've already warned them there'll be more certainly coming as we get forth, we proceed with this with RFA and we get some applications. So anyway, I'm going to give you guys back some time in your lunch hour so you can finish eating if that's what you're doing, or take some time to eat. But I'm happy to stay on for a while for any folks that want to ask some questions in a fewer participant environment. Otherwise, thank you so much for joining today, and we really appreciate your interest in this RFA. And again, those wanting to stay around, go ahead and feel free to unmute and ask any questions, and we'll hang on, and as long as you hang on. So good to see some of your faces, and Perta Stuart, so great to see you, and Jonathan.
Thank you so much. It was great seeing you too. Thank you.
Oh, thank you for what you're doing, and you taking the helm of a brand new residency program. I'm so thrilled.
Okay, it has been a ride, but I'm so happy that I did it. So
oh, good. I'm great.
Our area actually really needs a primary care residency program here, so it's the right place actually.
Good. And you're the right person.
We started the family medicine and psychiatry program too. We have a very strong behavioral health unit, so it might be opportunity for both program actually.
That's fabulous. Thank you.
Of course.
I just have a quick question. We are a partner of a couple different residency programs, but my organization itself is not an ACGME accredited residency. Would we be eligible to apply for the grant along the terms that were described?
Yeah, as long as, again, the residency program itself is front and center of what you're doing, what the action is. Again, we are happy to fund, pay the money directly to a separate entity. But again, the residency program has to be front and center. We need to work with the residency program. So we will have you identify a program lead, and that person needs to be somebody in the program itself, as well as a team lead that is, we call it a team. Is that what we call it? Team lead? I think, Anita, yeah, to work on the QI project specifically, that kind of brings together the team working on the QI project. But yeah, Jonathan, we certainly encourage you to, be a support and a service to those residency programs who are doing the great work and partnering with them. So we don't put any restrictions on that, as long as, again, the ACGME accredited program is identifying the goals and doing the great work.
Thank you so much. That's great news.
Absolutely.
Hi, Jerry. If I could ask a question
Absolutely.
specific to the SMART objectives.
Yes.
So my agency, Family Health Centers of San Diego, we have a family medicine residency program that's ACGME accredited. And we're going to be initiating a psychiatry residency program in the next couple of years. And so as I'm reading through the RFA, I'm seeing that the main thrust is to expand learning around linkage to MAT and linkage to SUD services among residents. And the guidance around SMART objectives specifically references linking them to the broad goals, which are on page 4, which I read more as patient-centered, right? So like identifying folks who need treatment, initiating them in treatment, retaining them, expanding harm reduction. So just so that I'm clear, it sounds like the SMART objectives you're looking for are not necessarily around expanding curriculum or learning experiences or didactics, more around the delivery of care for the patient population.
No, I mean, I think even though that is stated in that way, honestly, you can't expand the delivery of care, you know, realistically without that first educational component. So absolutely focusing on education is important and required. So don't feel hampered by that statement about the goals if that's your focus, because clearly we want to see the capacity built at the residency programs from the bottom up. And so it starts obviously with education and building the confidence of those residents and providers to service those patients. So I hope that doesn't stop you from moving forward in identifying goals in that area.
Thank you.
Yeah, absolutely.
No, that helps a lot. And I just wanted to clarify. So when I look at the phrase harm reduction, I think in our world, harm reduction is sort of around, we have a syringe exchange. And so that's sort of how we think of harm reduction. Is there another way that I should be thinking about that here?
Well, I mean, there's syringe exchange. There's obviously the distribution of the harm reduction kits, the fentanyl test strips, and other ways. So we are completely open to any harm reduction activities that you think will really sell in your local area, because it is so, you know, patients don't trust providers a lot of times, so anything that you think compels those people in need to get the services they desperately need, we are all in on, as long as obviously it meets the requirements for the funding, SAMHSA requirements, and the DHCS funding requirements, which I'm really disappointed actually this year that we have to break off the contingency management funding, because it really was part and parcel of a lot of what our former grantees use their funds for. But it's not that the funding isn't available. It's just you got to jump through another hoop to get it. So yeah. Got it.
Okay. Thank you. I appreciate
it. Absolutely. We appreciate you being interested.
Thank you.
Yeah, absolutely.
Thank you, Leah. Jerry, we have another question from Emily. So the question is, should the program lead and team lead be different individuals?
Okay. Well, that's a good question. We honestly do think they should be. Do they have to be? Technically, no. But the reason we think they should be is the team lead is the individual that really is focused on the QI project itself, which is kind of one piece of your overall grant and your overall activities, I think. So that QI person is the one that goes into the portal. We have a portal that IPMA develops that helps you deliberately set up the steps to reach your goals that you identify. And we expect that team lead person to bring in not only the prescribing providers, but also everybody else, the support staff, the SUN, substance use navigators, everybody on the team to help reach those goals. And we just think it seems to be more successful when we have two separate individuals, but it's not required. So I'll say that it's not required. We want to help you folks be as successful as possible. And we've found that when there's one champion, one person in the program who's all gun-ho, they apply for the grant and what we find is they get, unless that's all they do, and we know that's not all they do, they end up really getting overwhelmed. And so it's a way also for us to kind of assure that it's more than a one person show here, that they have support from their programs to really move forward in the direction that they're identifying in their grant applications. So required, no. Suggested, yes. So, and a lot of times it's the program director, many times it's a chief resident, it's like, we want you to identify what works best within your own programs, clearly. So, and we know every program is different. And we also don't, if you want to team up with other residency programs, that's certainly acceptable as well. So, yeah. Great. I love the St. Joe's logo there. Okay, well, like I said, we're going to stay on here and look at your little black screens, except for you, Kirstu. Thank you. Until you either chime in with a question or we run out of time. And like I said, no questions are dumb questions. And we will, like I said, we will also post up all FAQs up on our website. We're going to send you guys the link. We're here to support you do your fabulous work. And really, we're really excited to be able to do this grant again and run this initiative for DHCS.